Hey guys, Thomas here from Train Fully. In this video, I'm going to take you through a quick assessment to see if you have a tight muscle in the back of your leg that could be causing a restriction in your backswing, pulling you out of alignment and contributing to inconsistent ball striking. And of course, if we do find a restriction there, I'll show you how to remove it. As you move through your backswing, your trail knee extends and your trail hip adducts and internally rotates. This requires good flexibility in your biceps femoris. The biceps femoris is part of the hamstring complex, which consists of three muscles: biceps femoris, semitendinosus, and semimembranosus. All three hamstring muscles originate from the same spot on your pelvis called the ischial tuberosity, and they all insert below your knee onto your tibia. Biceps femoris laterally though, and the two semis medially. Therefore, because of their line of pull, all three hamstrings flex the knee and extend the hip. But because the two semis run medially, they adduct and internally rotate the hip, whereas the biceps femoris runs laterally and therefore abducts and externally rotates the hip. Now, we learned earlier in the video that as you move through your backswing, your trail knee extends and your trail hip adducts and internally rotates. These are the opposing joint actions of the biceps femoris. Therefore, if your biceps femoris is tight, there will be a restriction in your backswing and you will not be able to maintain your angles. The result will be inconsistent ball striking and a loss of distance. So if you're struggling with consistency, I want you to assess the flexibility of your biceps femoris, and here's how to do that. This is the 90-90 straight leg raise test. Begin by lying on your back with feet hip width apart. Take one leg and flex your hip and knee to 90 degrees so that your knee is directly above your hip. Now stabilize your thigh by placing your hands behind your knee. Now simply try and straighten your leg as much as possible. This is a positive test if you do not come within 20 degrees of full knee extension. And of course, I want you to assess both legs. So what does a positive test tell us? Well, this is commonly referred to as a hamstring muscle length test. But as a kinesiologist and human movement specialist, I have to peel back layers and go deeper than that. So when I think in terms of postural dysfunction and movement impairment, I know that of the three hamstring muscles, the biceps femoris is the commonly overactive one. Therefore, a positive test tells us that you have a restriction in your biceps femoris and therefore a restriction in your backswing. Here's how to remove that restriction. This is self-administered static release of the biceps femoris, which again is the lateral hamstring. I'm using a ball to apply pressure to adhesions or trigger points within the biceps femoris. To find these trigger points, I want you to survey the entire lateral aspect of your hamstring from about midway down your thigh to just above your knee. You're looking for the most tender spot. That's the spot with the most adhesions, and those adhesions are what we are targeting. The pressure applied by the ball activates mechanoreceptors inside the muscle and initiates a neuromuscular reflex called autogenic inhibition, which causes those adhesions to break up and the muscle to relax. Now, if you want to increase the intensity, you can push down with your hand to provide a little overpressure. So once you find that tender spot, I want you to stay on it for 30 seconds to 2 minutes or until you feel a release. Okay, so this is an active stretch for the biceps femoris. We start in the same position as the 90-90 straight leg raise test. Take one leg and flex your hip and knee to 90 degrees so that your knee is directly above your hip. Now remember, we want to isolate the biceps femoris, which again is the lateral hamstring. To do that, I want you to use your opposite hand to grab your thigh just above your knee. Now pull your thigh towards the midline of your body, and from here, try to extend your knee and bring your foot towards the opposite shoulder. And hold that position for 2 to 4 seconds and relax. Repeat this 12 to 15 times on each leg. All right, so if you're having a hard time maintaining your angles, it could be because you have a tight biceps femoris. So I want you to check that with the 90-90 straight leg raise test. If you do find that there's a restriction there, I want you to first perform self-administered myofascial release with a softball or a baseball 30 seconds to 2 minutes on each leg, and then perform 12 to 15 reps of the active biceps femoris stretch. And of course, guys, if you have any questions, comments, feel free to reach out to me. And as always, I hope you enjoyed this video. Thank you for watching.